Welcome to Snip and Sip, the podcast where we cut through the noise about plastic surgery while sipping our drink of the day. I'm your host, Dr. Scottsdale, from my real name, Dr. Mata. We're gonna talk about funny, we're gonna talk about trends, we're gonna spill the tea and all the secrets. All right, guys, welcome back to episode 7 of Snip and Sip. We're joined today by our special co-host, who is otherwise known as
Scottsdale Snatched.
And this is Dr. Benjamin, and my lovely co-host to my left this time, who is
Nurse Scottsdale.
Again, Janeth, my wife. So are you guys excited about this episode?
I am.
Pretty excited. Thanks for having me, guys.
Well, thanks for being here. And so what are we going to talk about today, Jay?
About blood, guts, and Botox with Dr. Benjamin.
Yes, he's uniquely qualified to be talking about this subject because he is board-certified general surgeon and a board-certified plastic surgeon, right?
Yeah, I've had 2 lives, dual lives apparently. I've been in school for a long time.
How long was general surgery training for you?
So it was 5 years. I spent it in my hometown in Chicago, University of Illinois, Chicago. It was a great experience. Did a lot of transplant, a lot of trauma in Chicago, I'm sure, as you guys have seen online. And
The Knife and Gun Club?
Of course, we had like a 65%, I think, trauma rate on everything that was coming in. So it's an eye-opening experience for sure.
All right. Well, before we get too far, what is our drink of the day, Nurse Scottsdale? Well, what is it?
It is a soda, like a probiotic soda.
Okay.
So let's give it a try.
Non-alcoholic, but we're going to try it out.
This is good for the gut.
It's pretty tasty.
It's actually not bad.
No sugar.
No sugar.
And it's strawberry, I think.
I don't taste any strawberries in this.
It is. It has a good
You taste
flavor.
strawberry?
Maybe a hint. It always has that that weird aftertaste, I think.
Because there's no sugar.
It's a probiotic. That basically means it's supposed to make you go poop, right?
It might help you guys out.
I'm okay. I'm not as good as you that poops every day, but so since we have Dr. Benjamin and he's uniquely qualified to talk about general surgery, how do you think plastic surgery and general surgery kind of intersect or overlap or kind of come together?
You know, it's pretty interesting. I never thought I was even going into plastic surgery. Some of my patients kind of know this. I was a general surgeon at first, and that's where I thought I was going to stay. And in many ways, both fields are very similar. You know, for both general and plastic surgery, you're able to operate pretty much anywhere in the body. The only difference is with general surgery, not always, but we're often in the abdomen or we're in the chest, whereas with plastics, you're sort of on the outside. But you kind of look at the same anatomy with a different set of eyes, and they go hand in hand. You know, plastic surgeons pay attention to certain things that general surgeons kind of gloss over.
Closing?
Yeah, closing especially. Like when I was a trauma surgeon back in the day, you know, there was a whole bunch of stuff that I was just like going straight through because my focus was on, you know, the trauma or whatever it was that I was trying to accomplish. It wasn't really the cosmetic outcome, but as a plastic surgeon, you kind of learn to appreciate. You're like, wait a second, you know, if I just took the extra time to do something different, you know, I'd be saving the patient from a lot of heartache, and even the scars alone can cause quite a bit of PTSD. And so it's like, it's kind of looking at things from a different set of eyes, but they're similar. They're intertwined in many ways.
I would agree.
So would you say being a trauma surgeon, you're looking more at functionality versus making things pretty?
Exactly. I think your surgery is more directed at solely a function, and the cosmetic sort of result is an afterthought, which is unfortunate because you're missing out on all this, you know, aftercare, and you don't really think about what happens to the patient after, you know, you're done with the surgery. You're like, I accomplished the surgery, what I was supposed to accomplish, but the patient's got to deal with the ramifications afterwards.
Right, so having done both, you think about both things now.
Exactly,
right? Like
and how they interplay, both the cosmetic and the function. And that's, I think, as a plastic and reconstructive surgeon, you become a lot more well-rounded because you're appreciating both of those things together.
You know, I think what's difficult for me is I did what's called integrated plastic surgery training. That means I did some general surgery, but I did more plastics than I did general surgery. So I didn't get in the abdomen all that often. And could I take out an appendix? Sure. Could I remove a section of bowel? Sure. But would I do a liver case? Anything crazy like that? Absolutely not. No Whipples for me. No low anterior, resections. I was involved in those cases when I was the plastic surgeon, and I was moving, VRAMs into filling in these holes where basically you no longer can poop from your bottom. You have to poop from a bag, but we have to close the hole and it can't get infected. So we move a piece of muscle and skin into that area. So I wasn't really involved with general surgery all that much, other than to understand the fundamentals of being a general surgeon and knowing how to take care of patients, which is priority number one. But I think, I think it was a little different for me when you had our first baby, Jordan. I got to be part of the surgery because I was closing her incision. And so the OB was doing their part. And, they were literally tearing you apart. Like, if you've never seen an actual C-section delivery, they literally have to pull you as hard as they possibly can apart.
It's pretty brutal. It's definitely brutal.
And I mean, even as a general surgeon or plastic surgeon, we would never, ever stretch the tissue the way they do. But they literally take your muscle, your rectus, and literally, I mean, you're pulling as hard as you possibly can, literally trying to rip a human in half to get another human out. And I'm watching this and I'm like, holy shit, that's my wife. Well, you weren't my wife at the time, but
Baby mama.
And they're literally pulling her apart. And I'm like, holy shit, in my head. And I'm like, damn, I'm going to have to deal with this.
Yeah, that's all the afterthought. It's like, well, they have one thing that they're going for, but they don't really consider all the other things that come with that.
It's never about the mom. It's about the baby at that point.
Exactly. It's like respecting tissues and all this sort of thing that we learn in our training. You don't necessarily always get all of that in general surgery. And the other thing is, general surgery is very scripted. There's like steps that you're supposed to go through. And in plastics, they have steps, but they're more guidelines. You got to be able to, call audibles, get creative. Not everyone follows the textbook, especially in plastics. And so if you're not able to sort of veer off what necessarily your measurements are, or what your guidelines are, there's no actual steps. It's more of a creative type of surgical field. So I think that's making that leap from something that's like literally step 1, step 2, step 3 to, well, these are your guidelines, but you got to make it look good somehow. That's that leap between the two that was, it takes practice. It takes practice to get better. That's where experience really comes into play, I think.
It's the practice of medicine. We're always practicing to be better. How do you think this deals with what you do or what you see? Because you see a lot of patients for all the pretty stuff, like the lasers, the Botox, all that stuff. But then you sit here and you're kind of a therapist, right? They talk about their issues with their scars, or they had this surgery or that surgery, or they seen this surgeon for a hernia.
Like every scar has a story to be told. So yes, I'm a little bit of a therapist because, that brings their insecurities as well. So I have to listen first and then kind of make a judgment to see what is really bothering them. Is it really the scar, the way it looks like, or is it maybe because people made fun of them, or just the history that it came with? So I see, and I do see a lot of your patients too, like after, just to kind of do a little scar revision or a little scar, just to make it prettier and better.
And, I think the hardest part about what we do as surgeons is we can't control scars. Like, we do our best to mitigate them or to lessen them, but there's always going to be a scar. And I think the difference between plastics and any other surgical specialty is that our job is to focus on what you see, which is the scar at the end. It doesn't matter what you do on the inside. Everything you're going to be judged on is what they see on the outside. And if the scar doesn't look right, they're going to be like, hey, you weren't a good surgeon.
Exactly. What did you do on the inside if the scar looks terrible? So, it's all about tension and inflammation. And those are the two things I always tell my patients. Like, as surgeons, we try to minimize the tension as much as we can and the inflammation. But at the same time, there's a lot of factors that go into that. So it's all about, staying up on your scar regimen, the scar creams, and then watching that scar mature over the course of the year. And if the outcome isn't what you want, that's when, I usually recommend my patients to see you. Like, oh, well, can we do CO2 laser? Can we do microneedling? Or do I need to just cut it back out and sort of reset that process?
And I think the hardest part about always resetting something is you're literally starting from day one all over again.
Yeah.
And then you're waiting for that process. But also understand that some people just genetically are predisposed to having bad scars. It doesn't matter who does the surgery. you're predisposed to bad scars. And because we do a lot of work on people who've had work elsewhere, we're dealing with those scars. And anytime you take a patient who's had previous scars or their anatomy isn't the standard of what most people have, it's going to change things. For example, I always talk about breast. Some people are born with something called tuberous breast. That's where the breast is really coney, the areola, the color part's really big. And so you try to do things to kind of minimize it, but when you put an implant, it's trying to stretch it. And so what's going to happen to the scar?
Exactly. It makes it that much worse because of the tension, guys. That's all.
And like I said, inflammation, tension, but if you're doing something to purposely create a lot of tension and then you're trying to prevent it, it's a catch-22. What's it about? Is it about the scar or is it about the result? And usually most patients will err on the side of, I want to look good in clothes. The out of clothes part, that's to your significant other. But again, our job is to do the best that we can, but understand nobody's perfect. Even us, even though we do revision surgery is harder. It's always going to have issues, right? Like anytime you clean up somebody's mess from previous Botox or previous filler.
Absolutely, yeah. I have to go in and try and dissolve most of it if it can be dissolved and then start from scratch.
Yeah, I mean, that's what makes things difficult. The best time to do something is really the first time, the only time. Revising something is always twice, sometimes 3 times more work to try to get it back to what normal appearing or what we deem as normal appearing. So it makes things a lot more difficult, but it's possible.
We do what we can. We do
Exactly.
what we can, right, guys? So since we're talking about these crossroads between general and plastic surgery, and we've talked about how they overlap, are there certain circumstances where you come across patients that, oh my gosh, you had this, and so now you need somebody else, like a plastic surgeon?
Like I said, in my previous life, I was doing a lot of trauma. So one of the biggest things that we do, and there's no laparoscopic camera surgery when you're doing trauma surgery. It's all what's called an X-lap. It's a big incision that goes straight down the middle, especially when you have a gunshot wound, victim, your time is limited. So that's why we're going straight in. And, we see it all the time. I remember seeing it even throughout my training. I'd be taking care of a lot of the same patients, unfortunately, in Chicago. When you're dealing with trauma patients, a lot of them are repeat offenders. And so I'd take care of someone who got, shot as, in my second year or third year of training. And then by the time I'm a chief resident or even on my own, taking call, that same patient will come back, hey, doc, I remember you. And he'd lift up his shirt and he's got like a horrendous scar, and they'd come and see me and clinic, what can we do about this now? I'm like, well, I'm glad you're doing well.
I'm glad you're alive.
You're alive.
But you survived those 6 gunshots.
Sometimes we even had to leave their abdomen open because there was a lot of what's called spillage. So if the wound is dirty, you can't really close that. It gets infected, and then it heals with these, some of you guys know about wound care. They're called wound vac devices. And so they have these big vacuum devices to help seal the wound. When it heals, it's a horrendous scar. And so going back and revising that, cutting out parts of it, and then reclosing it and releasing some of that tension. Sometimes it takes multiple operations to get them to something that's a nice, fine scar. And sometimes they never actually get that nice, fine scar, but you try your best. Yeah.
Yep. I would say my exposure to that was when I was at MD Anderson. We would have these cases, but they were from cancer. It wasn't from the Knife and Gun Club of Chicago, but we'd have these crazy cases where these people, their intestines were literally hanging out of their body. Like they were skinny like me, but their belly would literally come out like this far off their body. And they literally just had a piece of skin covering their intestines where you could literally see them moving. You could see big turds moving around. And we would basically do what's called a component separation. That's where we literally, as Dr. Benjamin was describing, we're trying to cut out the skin graft, which is literally like taking wet tissue paper apart without cutting into it, and then separating their muscles into segments, and then closing the muscle with, biologics, which is using mesh made out of humans or pigs or shark or whatever other kind of material we could get our hands on, and then closing their stomachs so that maybe they wouldn't go from this to maybe half the distance. And it's always a struggle. And the scars are usually the least of the concerns, but as plastic surgeons, we're always trying to do our best, because those are combined cases with general surgeons where we would do our best, but sometimes as you're taking the skin off, you take a piece of intestine.
Yeah, exactly. Everything's so stuck together at that point. It's hard to tease different things apart. And so that's where it's like, okay, function or cosmesis. And I distinctly remember there were patients that I saw that came back after horrendous, traumas. And I'd be like, hey, man, you're alive, you're eating, you're drinking, everything's great. Personally, I think the risk of going back to try to make this a little bit better, it definitely outweighs, any benefit that you would get. And sometimes that's really the safest or best option. So you really have to discuss with the patient and sort of to figure out what they're trying to get and what their expectations are. But there are other adjuncts, even non-surgical. I remember quite often we would even laser some of these scars, and they'd dramatically improve. Would they be, 100% better? Of course not, but they'd get a dramatic improvement. So sometimes that's really the best option.
Yeah, no, I agree.
Would you guys say, do you guys work well together with like another general surgery if you guys were kind of working hand in hand, or usually it's not a good mix working with them?
I would say the plastic surgeon is like the surgeon's surgeon. We would quite often, we'd work with pediatric surgeons, we'd work with neurosurgeons, quite often to help close back wounds and things that were complicated, work with orthopedic surgeons all the time to close some of their hips. Sometimes they get their joints, exposed. And so plastic surgeons really work with everyone, including OBGYN. Anybody that's in the operating room, we're very much the surgeon's surgeon.
Is there somebody who's harder to work with? I would just say maybe plastic surgeons, you guys are the hardest to work with.
I would say they call us the princess of surgeons because we're the prima donnas, like we need this, we need that. And sometimes it is necessary to have the right tools. Like if you're trying to do a surgery and you don't have your main instrument, you can do it, but it's going to suck because it's much, much harder. Like when I go on mission trips and they're like, yeah, we have what's called a Dingman retractor. It's where you go in and it puts a tongue blade and you open the mouth because you're trying to fix the palate. But if you don't have that, how are you pulling the mouth apart, getting the tongue out of the way, pulling this out, and trying to do a surgery upside down without that instrument? And they're like, oh, you're a prima donna because you can't do it without it. And I'm like, I've been forced to when I go on these mission trips, but it makes it easier. But I think most surgeons have their tools.
Is that why you take your own?
Yes, now I take my own.
You have to. I like to think of us as closers. Like, baseball, it's bottom of the ninth, it's the World Series. You've worked so hard to get to where you are, but you got to finish strong. And that's where I think the plastics, we're literally closers, but we do a lot more than that. But
I think the best joke in the OR is, what's a plastic surgeon doing? Closing. We're always closing.
Exactly. Always be closing.
That's right. The ABCs of plastic surgery, always be closing, right?
Okay.
So do you have any experiences yourself
As
in
far
terms
as-
of being exposed to different specialties? Obviously, besides when I was involved, with your C-section and then having to close you.
I don't get your question.
Well, I would say, and any other circumstances where you've been involved with either being a part of it when you were in nursing where there were two surgeons and one might have been a general surgeon, other might have been a plastic surgeon.
I remember in nursing school, I just remember coming across a plastic surgeon. He was just not nice. Like we were in surgery and he was just like so needy and demanding. And then I remember like even getting into the elevator with him, he just like I was going in with my other classmates and he wouldn't move. He was like literally standing right, and we're like trying to squeeze, and like he could have just moved a little bit. He was just like standing there like, I'm not moving, I was here first. And we're like, what? And a-hole, like seriously.
you get that in every field. I think, in general, I'm sure everyone will tell you, my wife will tell you, doctors are weird in general. So you get eccentric personalities.
But I always
all over
said
the
that
place.
like plastic surgeons are just not nice.
She thought I was a nurse when we first met. A nurse, male nurse, right?
I sure did.
And then when I told you I was a plastic surgeon, what did you say? Oh, he's probably lying. He's full of shit.
Yeah. I mean, it's like, oh, maybe he can help me get a job. Yeah. Because I was in nursing school when we met.
And then most people really don't believe when you tell them you're a plastic surgeon. And then they're like, what's your Instagram? What's this? Before there was Instagram, it was like, I don't believe that you're a surgeon. I said, well, I don't know how to prove it to you. But then, the advent of phones, I can literally show before and afters, and they're like, oh no, those aren't yours, you took them from the internet. And now with Instagram, they're like,
Now they gotta link you up.
well,
Yeah,
they're
it's
like,
you're-
oh hey, you are that person, right?
Well, I think at first is like you left like a couple weeks after we met. You went to a mission trip and you were sending me pictures like before and afters, and I was like, oh, this kid's. I'm like, oh, I guess he's a surgeon.
You gotta prove
She thought I was
yourself.
lying. She thought I was lying. And then I think that goes to a funny story because we were supposed to go have dinner. And she's like, what do you mean you want to have dinner at 10 o'clock? Well, I was getting my master's in business administration. I was taking night school, even though I was a full-time plastic surgeon. And I was like, hey, you want to meet for dinner at 9 o'clock? And what did you say?
And I was like, why? Like, I'm just not down for just a one night stand. Like, this is not, like, I didn't meet you for that. Like, I'm not
Totally the wrong
interested. and then I thought to myself, well, he wants to meet me at a public place. It's not like, hey, can I come over to your house? Come over to my house. So I was like, I'm going to give him the benefit of the doubt. But I was so ready to be like, hey, you know what? I'm just not interested in this. And so I showed up, and he's like, no, I'm actually leaving tomorrow to a mission trip. It's like, oh, that was kind of sweet. Like, he was like,
I wanted to see her before I left. Do you remember where we met?
that day it was Lions Tempe Marketplace. What is it called?
Pub and Grill?
No, it was Lions something.
Lions Pub and Grill.
Yeah.
And yeah, we met. We hung out for like an hour, and I was like, hey, by the way, I got to go because my flight leaves like super early. And you're like, what? You made me drive all the way over here just to...
Well, yeah, because he's like, you're like, I don't want you to text me and I might not have reception. So I'm not going to text you back, and I don't want you to feel like I'm blowing you off. So I'm just like,
That's
what a
awesome. I did
thoughtful
not know
guy.
that story.
Yeah, I was like, what a thoughtful guy. So
It's all
Yeah.
about schedule planning.
So then,
you
yeah.
gotta time everything just right.
I literally met her like, 10 days, 8 days before I was supposed to go on this mission trip to Guatemala.
and then I guess you came back and I was gone. I went on a trip,
Yeah.
and then so it was like we're just text messaging back and forth, and then I think I got back, and thereafter like we started hanging out like almost every day.
That's amazing. And look, fast forward years later, now look.
I know, here we are doing a podcast together. 2 kids, 3 kids now,
kids
later,
now,
right?
yeah.
Time flies.
Yeah.
That's for sure.
So, well, I think we've gone over some of the real life cases, right? How do you think plastic surgery applies to these people that have medical conditions, at least from what you see?
I mean, a lot of these medical conditions, I mean, we can improve their quality of life. I feel like, people that have a malformation, I feel like you can help them, and they can have more self-esteem, more courage, and just make them look better.
Yeah, especially now with, the number one disease that we're seeing out there, of course, is obesity, right? So with the advent now with new medications coming out on the market, Ozempic and Mounjaro and whatnot, there's patients that are losing massive amounts of weight, which is amazing, which is great. They're working with personal trainers. They're motivated to get in the gym. The problem is when you lose so much weight so fast is you end up with so much loose skin. And it's like, well, you put in the effort, you're making all the right decisions to change, your lifestyle, but now you're left with all this like sort of markers of past things that happened. And so going to a plastic surgeon will definitely help reverse some of that, hopefully minimize the scarring, get you back into the shape, sort of reap the reward of the investment that you've already made in yourself. So I think plastic surgeons are crucial, working with bariatric surgeons who are general surgeons, So we all kind of blend together in many things that we do.
Yeah, no, I totally agree from that perspective, especially with the weight loss revolution that's now sitting right in front of us, whether you look at people on social media or not. Like you mentioned, the Mounjaros, the Wegovy, semaglutide, tirzepatides of the world. And again, the medication's only going to get better with time because they're going to continue to grow and evolve that market because, again, over 50% of Americans are overweight, probably obese.
Yeah, it's the biggest disease in the world, really, and now it's spreading. It's not just Western culture; it's all over the place. It's in the Middle East. It's all over. Yeah.
So I think there's going to be a big need for plastic surgery.
I gotta go. I gotta pick up our daughter.
Okay, so that's it. Nurse Scottsdale's got to go be a mama.
See you next time.
That's it. Thank you so much for
Thank
stopping
you.
by and being my lovely wife. Be careful.
We'll hold down the fort.
We'll hold down the fort while she's gone here. And so now we can do an all guys talk, right, guys? No. Just kidding, just kidding. But, I think the hardest part of the dynamics of what we deal with, right, is always about the expectation.
For sure. I try to remind patients, especially the tummy tucks and, the brachioplasty, we're trying to reverse years and years and years of trauma and tissue being stretched out and whatnot. And so it's hard to reverse that in a 3-4 hour surgery. We try our best, we really do, but sometimes it takes multiple operations to get you there, but we'll get you there. It just takes time.
You know, and I think the thing that people need to understand is we're human beings just like everybody else. That doesn't mean everything we do is perfect. There's always going to be hiccups or issues. But I think the biggest difference, at least between the both of us, is if you have an issue, we're going to fix it. But you still have to give us the opportunity to actually fix that issue. But understand that unless our names are God's and we're not, that will get you as good as your body allows. That doesn't mean perfection. That means better, especially when we deal with these revision cases, with these massive weight loss patients, with these trauma patients, especially when they've had surgery elsewhere. And I think that's where that big overlap that, as Dr. Benjamin said, we're surgeons, but understand that not all surgeons are created equal. And I'm sure in your training, you saw really good surgeons and surgeons that weren't that great. Some people who had amazing success rates, and other surgeons, you're like, gosh, if you got in their hands, you might not do so great.
Exactly. I mean, the variability between, yes, what was the running joke in med school? It's like the student who almost fails every class.
A D means diploma.
Diploma, that's it.
D is for diploma in medical school.
D is for diploma. You pass, you're still a visitor, but you may not be at the top of your class. So there's all sorts of variability in success rates, and certain people are good at certain procedures and not as good as others, at other things that they do. So you have to take all that sort of into account, but most importantly, it's allow your body to heal. I think that's like the one thing that I see is patients are so excited about their results that they're ready to go on to the next one and the next one. It's like it takes time, especially with the amount of liposuction sometimes that they get. It's like they forget what fat is. It's energy, right? When you get all that energy sucked out of you, your body won't tolerate another surgery, at least for a little while, until you heal. And then we're happy to help.
Yeah. And I think, expectation is one of those things, whether we're plastic surgeons or not, that it is our job to tell you what a realistic expectation is. But sometimes, at least in my opinion, sometimes people hear what they want to hear, even though we literally will tell you this is where you're going to end up with. And after surgery, you're like, well, why didn't I end up here? I told you this is, and we literally got here instead of here, but the expectation isn't met with the patient. And I think that's some of the hardest things we deal with, because like you said, as a general surgeon, you're like, I saved your life, but my scar is horrible. I'm like, you got shot 6 times and you got cut and you're alive and you're breathing, but you have an issue with the scar. And I get it. But at that point in time, the most important aspect was saving your life. And I go back to the specifics with Nurse Scottsdale here is I didn't have to, but I said, hey, I wanted to close her incision. And so, I was there, they closed the uterus. And then after that, I made sure that everything else was closed and I closed the skin. No big deal. It took 10 minutes. For our second baby, I didn't realize that I didn't have privileges at the hospital, so I couldn't close her. So instead, an assistant to the OB-GYN closed her. And then I literally think it took 5 minutes. They just did like one layer, and I was like, I can't say anything because I'm not there to criticize how they do it. I just let it happen. She ended up getting an infection. She ended up with a bad scar, and I got a bill for $4,000 for an out-of-network first assistant closure for a C-section scar that was this big. And I was like, I don't even make $4,000 over a 5-minute period.
Yeah.
That taught me a valuable lesson about insurance billing, about the OB didn't even close her from that standpoint. She got an infection. I still took care of it myself. I still had to do a scar revision on her because she didn't like the scar. So these are the things about expectations, guys, that I think our job is always to make them realistic so that you know what to realistically expect. But understand we're human beings. Not everything's always going to be picture perfect.
Exactly. And that's one of the reasons why we integrate a lot of photography. As my patients will tell you, you'll see we take photos of you guys every time so that when you finally get to that 1 year mark, you can look back, be like, this is where I started and this is where I am. And it's always a dramatic transformation, from start to finish. And then we could talk about, okay, what else can we do? So, it's a journey, and we definitely want to help get you guys there, but want to set those expectations just right to make sure that you understand where you're going every step of the way.
Our goal is always to exceed the expectations that you have, but understand that sometimes even your expectations can't be met because we can't turn the clock back. What's your favorite line?
My favorite line, of course, as plastic surgeons, we can reset the clock, but we can't stop time. Time keeps ticking forward. Tissues keep stretching out, especially with breast augmentation. Remember that implant doesn't age, but everything around it does. And so we can only do so much, but at the same time, we can help reset that clock as many times as possible as we need to.
Yeah, and sometimes that means multiple surgeries. So, what do you think was the biggest lesson you learned from general surgery?
And people that know me well will probably agree with this about me. I'm probably one of the biggest pessimists as a surgeon, but I need to be. That's as a general surgeon. That's what I was trained to do. Your surgeon should be the guy who can think of every possibility that can go wrong, but have an answer for every single one of those possibilities. So being a pessimist as a general surgeon actually helps me as a plastic surgeon, because I can try to, contemplate and think about, okay, well, what can go wrong? How can I fix that? How can I address that? How can I prevent these situations from occurring? So you try to see these algorithms, these almost kind of like permutations of the result in your head. Before you exactly, in many ways, right? But that's what it is. And in some people, they see it, they're like, oh, you're such a negative person. I'm like, no, it's not. I'm like, to be a great surgeon, that you have to anticipate everything, make sure nothing is unexpected. And that's kind of what I was taught as a general surgeon, as a trauma surgeon, because it's a mixed bag. When you open that abdomen, you're in a trauma, you have no idea what you're going to find out, but you got to be ready for action every single time. And so that's kind of what general surgery taught me in many ways. It glossed over some of the other stuff, unfortunately, but the skill set was dramatically improved. And the one thing I still fall back on is the critical care component. It's a lot of physiology, so you really get to learn about how patients heal, how patients resuscitate, the fluids they get during surgery, the fluids they get after surgery at home. Like, how does this affect wound healing? You learn to appreciate, the basic science of things. And you can apply a lot of those lessons to plastic surgery, cosmetic surgery, really reconstruction, everything.
Yeah, no, I totally agree with you from that perspective. I would say I'm probably the total opposite. I am more of the optimist.
Less of a pessimist.
Yes, we're all pessimists to some degree, but I prefer to err on the side of the glass is half full versus half empty. That's just the way I am from that perspective. It doesn't mean that I'm not prepared for the badness that could happen, but I'm always looking for ways for what can I do for that to be better. Not like what could go wrong. It's like, great, I did this. What else can I do to make it better?
Exactly. It's like looking at the same picture just from a different point of view. It's just
correct.
Like how you stand, how you react to it.
I think we both have our blindfolds on and we're touching an elephant, and I'm like, I see the trunk. You're like, no, it's a leg. And I'm like, well, it depends on the perspective, right?
Exactly. That's very true.
So anything you'd like to add?
I'd just like to say, I think, it's very enlightening to, surgery, and you learn this about surgeons in general. This is where sometimes patients forget it is a practice. It's the practice of medicine. And so we've taken an ethical and moral code to be here, to be able, it's a privilege to be able to offer this service. And so we work with our patients, and we're both working for that same goal. We may be coming from different points of view, just kind of like we were talking about, but we want to get you those results that you're looking for, that are long lasting, that are natural, that never go out of style. And so, balancing that with the function, I think that's where some of the general surgery definitely helped me as a surgeon. But we just both, from both the general surgery world and the plastic surgery world, it's very interrelated. Back in the day, years ago, surgeons, the original surgeons were actually barbers, I think.
Mm-hmm. Barbers, yep.
And so, there used to just be general surgery. It was just that. And now it's really fragmented in many different things, but ultimately it's all about taking care of you and trying to meet those expectations that you have of yourself, and doing what we can to help you get there. So,
no, I would say that's a great wrap-up point. I think from my perspective, when it comes to general surgery and plastic surgery, is that as a plastic surgeon, you don't actually have to be a general surgeon. You could be a neurosurgeon, you could be an ear, nose, and throat doctor, you could be an ophthalmologist, you could be an orthopedic surgeon. Those are different avenues for somebody to then do additional training to become a plastic surgeon. And what you guys need to realize about plastic surgery, it is a surgical specialty that requires an intro before you become that. It's crazy. You have to be an orthopedic surgeon. You have to be an ophthalmologist. You have to be an ENT. You have to be a neurosurgeon, general surgeon. And then, and only then, can you become a plastic surgeon.
Yeah.
Which is pretty crazy to think that these people who are at the top of their game still have even more to learn to become a plastic surgeon. Not to say that it's any better or any different. It's just unique in the sense that all of these specialties will help you become a better plastic surgeon. And I think for me, the thing that I learned most about general surgery when I was in general surgeon was seeing a true general surgeon. And I'm talking about somebody who trained probably in the 60s and 70s compared to 70s, 80s, 90s, 2000s when I was doing my training. That back in the day, a general surgeon was a surgeon's surgeons. Their training was like 10 years. They did from literally head to toe. And as medicine continued to grow and evolve, every specialty said, okay, well, general surgeon, well, maybe we're going to do this. It used to be eyes, ears, nose, and throat. And then it became ophthalmology and then ENT.
Exactly. Things have fragmented over
Correct.
time.
And so everything was taken away from a general surgeon because they're like, oh, no, well, I know you know how to do this, but we're going to do extra training in this to be even better at it. So the general surgeon got less and less and less into... Nowadays, at least when I see general surgeons, they either focus on a specific specialty like vascular, they do GI, or they do laparoscopic or robotic or, cancer surgery or oncologic or breast surgery. And we didn't even get to the whole aspect of breast reconstruction where the cancer surgeon or oncologic breast surgeon takes the breast and then we make a new breast from nothing, right? I mean, we didn't even get into that
That's
topic.
a whole another, especially even within itself, the people that do just breast surgery, and then there's plastic surgeons that just focus on that breast reconstruction aspect, both from your own tissue, meaning like an autologous flap, or from using implants and tissue expanders to reconstruct you. That's a whole field within itself. And so there's just so many different aspects to it. And that's kind of what makes it fun. That's what attracted me to the field, because in its core, plastic surgery was the original, the OG general surgery. And I have to say a shout out to all the rural general surgeons out there. A lot of guys that I worked with actually when I was in Chicago, out in the boonies, that were transferring patients. They still practice true general surgery because there's no one out there.
Correct. They do everything.
They do everything. They do craniotomies. They do neurosurgery. They do everything because they're it. And if you're privileged to live in a big city where everything's fragmented, you get to pick and choose. But if you're out in the middle of nowhere, sometimes that's all you got. So,
yep. Yeah. When I was in the military, that was one of those things when we went to basic training that they didn't like me. And the reason I wasn't liked was because I wasn't, board certified general surgeon. So when I would theoretically get deployed, they're like, well, do you know how to do a craniotomy? I said, I do, but I've done like 2 or 3, not like, hey, I've done 20 or 30 or 40 of them. Yeah. And so that's where it's kind of sad that medicine has become so compartmentalized for everything. And as plastic surgeons, they've had a lot of things taken away from them, or surgical subspecialties have developed. And now I know like vascular surgery is its own thing now, right?
Its own thing. It's even got an integrated route, and that
kind of like plastics.
Exactly. And even colorectal surgery is moving that way. So things are very, very fragmented, unfortunately, which I think loses some of that continuity of care. Like you kind of you have these blinders on and you're stuck in your lane, and when something veers off, because sometimes disease processes and anatomy doesn't necessarily follow the textbook. It's not highlighted. There are no arrows that tell you what you're looking at.
It would be nice.
It'd be really nice. It doesn't work that way. And so when something happens unexpectedly, they're kind of caught with their pants down. And I think that's where I like being a general surgeon, because I'm like, oh, I know what's there, and I know what's under there, and I know what's around there, and that's, I think, where you get a little bit of an advantage, I think.
Oh, I would absolutely agree. Sometimes I look at hernias and I'm like, yeah, I don't want to mess with that. I know what's there. And I just have no interest. Versus you're like, yeah, I could open this up. It's no big deal. I could take care of it, whatever. And so I tell patients, I'll fix whatever I can within the realm of my abilities, but I'm not going to sit here and kind of overdo something, because I know I had a patient once who came from out of town and had this huge inguinal hernia. And he wanted a mini abdominoplasty, and I was like, okay, great. I was removing the skin, and I got there, and I'm like, damn, it's a massive hernia. But I wasn't going to sit here and fix it because, one, I didn't have consent, and two, if I'm fixing that on one side and all of a sudden he has pain, and they're like, well, how do you know how to fix this? I said, well, it was part of my training back in the day, but I'm not a specialist at it anymore.
And then techniques change. They also change quite often. That's one of the things where you guys always see us posting about going to different conferences and whatnot, because what might be right today in a couple of years may not be. Maybe it's a totally different technique. Like, oh, what you guys were doing before, don't do that anymore. This is actually the way to do it. And so things always change. And so it's difficult to be the master of everything. You try to sort of pick your field and at least become the master of that and keep up to date with different types of things in terms of different procedures and how they're performed and what new techniques and new products even are out on the market. So.
Correct. You always want to stay up and evolved. So what's our word of the day, Dr. Benjamin?
Word of the day is, of course, Scottsdale Snatched.
So that is the word of the day. And you know what it gets you if you DM us that? It gets you a free consultation with the one and only Dr. Benjamin here.
Always happy to help, guys. Looking forward to seeing you guys in the office.
So that's basically it for our episode. And next week, we're going to be talking about celebrity moms versus real moms. Why do celebrity moms recover faster?
I know nothing about celebrities, so I'm
It's okay. Well, stay tuned next week, guys. And again, this is it for episode numero 7 of Snip and Sip. And again, follow us on TikTok, Twitter, well, not Twitter, X, YouTube, Instagram, Facebook.
We're everywhere. And cheers, of course.
Salut. Till next time. I hope you had as much fun listening as we did recording. Don't forget to follow us on Spotify, Apple Podcasts, and all podcast sites for new episodes, as well as Instagram, TikTok, and YouTube. Stay snatched, stay hydrated, and until next time, cheers.